Hey guys, I am so thrilled to talk to you today about the micronutrient treatment of mental health disorders. We're going to talk about improving outcomes in depression and anxiety using a root cause testing and food as medicine approach. Quick disclosure, I work for Rupa Health as our head of medical education. I'm going to talk to you guys about some of the important landmark studies that have changed the way we conceptualize the biochemical underpinnings of most mental health disorders, and then the micronutrient interventions that you can use to help your folks recover from them. And so we're going to talk about increased oxidative stress, inflammation, low total antioxidant capacity, and micronutrient deficiencies as they relate to mental health conditions, particularly anxiety and depression. Now, I have another talk where I go into insomnia and bipolar. We're not going to do those today. We're just going to stick with anxiety and depression due to time, but I'm happy to come back at a later date, talk to you about those other illnesses. So, how many people do you think will experience a mental illness in America this year? The answer is 20% will experience one this year, 50% will be diagnosed with a mental illness at some point in their lifetimes. That's 67 million Americans who are going to have a mental illness this year. And there's simply not enough providers to serve them. So, right now, more than 150 million people in the US live in a federally designated mental health shortage area. And within the next few years, we're going to be short over 30,000 psychiatrists. Already, 60% of patients who get mental health care in the US get it from their primary care provider. And so we really need everyone to be equipped to help to respond to this crisis. And you guys can do that using natural interventions that are totally within your scope. Whether you're an RD, a naturopath, a chiropractor, you can use these nutrients to help your clients heal. And this is very evidence based. So let's go through some of the evidence. This image is from one of my favorite papers called The Role of Nutrients in Protecting Mitochondrial Function and Neurotransmitter Signaling Implications for the Treatment of Depression, PTSD, and Suicidal Behaviors. You'll see that there's evidence of increased oxidative stress with F2-isoprostanes and 8-hydroxy-2-deoxyguanosine, which we'll go through in 1 second. But before we do, I'm going to talk to you guys about depression first because there's a ton of research on depression and inflammatory biomarkers. Depression is our second most common mental illness in our country, and it's got a really high hazard ratio for co-occurring with the other disorders. So GAD, ADHD, alcohol dependence are all linked with depression. And this is generally because they actually share a lot of the same root causes. And so going over depression helps us understand the root causes of many mental health conditions. So this is a paper showing that depression is associated with increased levels of F2-isoprostane and 8-hydroxy-2-deoxyguanosine. Now, those are markers of oxidative stress. F2-isoprostanes are oxidized metabolites of arachidonic acid, which is already pretty pro-inflammatory. It becomes thromboxanes, prostacyclins, prostaglandins in our body, and that causes a lot of oxidative stress, meaning it's going to damage our cell membranes. And 8-hydroxy-2-deoxyguanosine actually reflects DNA damage. People with depression have increased oxidative stress, and it's affecting their bodies down to the DNA level. We also know that increased oxidative stress is linked with something called lower total antioxidant capacity, and that can be defined in a few ways. Typically, when we're talking about total antioxidant capacity, there's a few ways to define it in the literature. Some researchers define it as a combination of zinc, HDL cholesterol, uric acid, albumin, vitamin C. Peroxidase is not typically measured, but is rarely measured. And they can also measure in a benchtop reaction. So taking your blood and putting it in a petri dish and then dropping iron in it and seeing how much it oxidizes can be a really interesting way to measure the antioxidant status of someone's blood. And the reason we do this, by the way, is because oxidation is what causes rust in the environment. So when a metal is exposed to oxidative stress, it rusts, it gets weak and brittle, and it doesn't function as well. That same thing happens in our bodies. What happens to our cells? We get disrupted cell membranes, disrupted cell signaling, and chronic illness. So anyway, super interesting. They calculate this using iron and watching if it rusts. We can also look at things, like I said, vitamin C, vitamin E, uric acid, albumin, HDLC, and zinc. This is actually showing on the right what happens when someone takes an antidepressant. Their levels of many of these antioxidants actually increases after taking an SSRI, which is fascinating and should make us question a little bit of how we think these interventions work. This is another way to calculate total antioxidant capacity. It's actually to just look at someone's diet. So you can run their diet through a nutrition software that looks at the amount of vitamins, minerals, omega-3 fatty acids, and macros that they're getting, as well as fiber. And this can be really instructive. If you're not someone who's used to checking this for your clients, I want to invite you to do it just a few times. Do it even for yourself for a few days. It's really eye-opening. It's going to get you really interested in nutrition because you're going to start to realize no one is consuming 100% of the nutrients they need in a day in your practice. It will make you a better clinician because you're going to start to realize that your clients are much more likely to suffer from a nutrient insufficiency than we once thought. Things that back up this research, we know, for example, from the NHANES study, that people who have higher oxidative balance scores imply exposure to more antioxidants. They also tend to have lower rates of depression. Same thing, eating a diet that is deficient in protein, B vitamins, vitamin D, magnesium, zinc, selenium, iron, calcium, and omega-3s has an impact on brain function and makes it more likely that someone's going to have depression. So making sure that someone consumes antioxidants and enough of these nutrients gets to be really important, and I'm going to teach you how to do that. Now, we also know that things like HSCRP are increased in people with depression, and that's just a marker of overall inflammation. And when we give people omega-3s, it actually helps to bring this HSCRP down, improve their depression scores. So I just mentioned a ton of chemicals in the last few slides. Most of them translate to biomarkers. And so if you're looking for a quick list of biomarkers to check in your folks with depression and anxiety, this is a good place to start. I'm going to chat through some of the nutrient biomarkers that show up here and some of the ones that are affected by nutrients. So simply having more antioxidants in your bloodstream is going to make it less likely that you suffer from oxidative stress, which is that imbalance between antioxidant capacity, oxidation. When oxidation is higher, that's when you get oxidative stress. So this is how you check someone for these. And in case you're thinking, my clients aren't at risk for nutrient deficiency, Kate, you don't know what you're talking about. According to the CDC, 31% of adults have a deficiency, whether it's B vitamins or iron. And just taking a multivitamin will cut that risk by 14%, down to 14%, excuse me. So if you do nothing else, make sure your client is taking a multivitamin. Even those of your clients who are eating fortified foods are still not getting enough of these important nutrients, fun fact. And the number one deficiency in the US is actually vitamin B6, which surprises most people think it's magnesium or a B vitamin that is like B12 or folate. They don't tend to think of B6. And that matters because you need B6 to make dopamine. So you can see here in the upper right-hand corner, all we do is combine tyrosine and B6, and that's how we get dopamine. We take some vitamin C, we turn that into adrenaline. This is a really critical pathway for making dopamine, but also all of our other neurotransmitters, as you'll see in a minute. Beyond what we just talked about, let's drill down a little bit more into why you would check vitamin D and what you would do if you found that it's low. So we know that vitamin D is more likely to be deficient in people who are depressed, and that when we supplement vitamin D appropriately, we can decrease depression scores, improve sleep, increase glutathione, and increase total antioxidant capacity. Excuse this spelling error in this. And this paper is from 2019. It's a really cool read if you want an overview of vitamin D and depression. To get more vitamin D, you'd have to give your clients cod liver oil, trout, or salmon every day, pretty much. And so if you're not doing that, a supplementation is really appropriate here. Now, you can teach your client to get these through food, but you really have to design a meal plan that actually ensures they get vitamin D every day. Salmon one day, trout the next day, cod liver oil the next day, and rotate. Otherwise, just telling your client to eat more fish is not going to be enough because even if they eat it once or twice a week, it's still only going to give them about 600 IUs, which is what you need each day as an adult. So really making sure your clients get enough of this per day. And this would not be enough to replete someone who is deficient. So check your client. Things that would increase your suspicion that they have a vitamin D deficiency include if they wear a lot of protective clothing outdoors or live in a latitude where they don't get consistent vitamin D exposure. They have a malabsorption disorder like celiac. They have hyperparathyroidism, increased skin pigmentation if they spend a lot of time hospitalized, if they have osteoporosis, and if they have obesity. Signs and symptoms other than depression are issues with bones and muscle weakness. You want to keep levels somewhere between 50 to 100 nanomoles per liter is what is considered optimal, or 20 to 40 nanograms per milliliter, depending on how you're measuring. If vitamin D is deficient, serum parathyroid hormone may also be elevated. And then you want to dose appropriately to bring them up to normal. A lot of more natural physicians will not do 50,000 IUs per week. They like to space it to daily instead. And then after week 9, dropping down to 800 IUs a day and rechecking to make sure your client is now replete is really important. Omega-3s are also significantly linked with depression. Depressed people are much more likely to have lower red blood cell omega-3s than their counterparts who are not depressed. And supplementation improves depression. So you want your clients to be getting at least a gram per day, more like a gram and a half. And the way you'd have to do that is by having them consume salmon or a combination of flax, chia, and walnuts every single day. So ALA is a plant-based source of omega-3 that can be converted into EPA and DHA. EPA and DHA are the active forms of omega-3 that we tend to use more in our cell membranes. Depending on the type you're using, with ALA, you have to consume only about 15% is converted to EPA, DHA, so you need to consume about 8 times the amount of fish-based omega-3s that you would need to consume. So aim for about 2 grams of fish-based omega or 15 grams of the plant-based omega ALA per day. You can test body status of omega-3s really easily. There's a lot of red blood cell omega panels you can check. Sometimes it's combined with omega-6 because you want your omega-3 omega-6 ratio to be optimal, because that is important for balance. You can also check arachidonic acid in the blood, and you can even check ALA and see how it's converting into EPA, DHA in the blood as well. So there's a number of ways to check omegas. Whatever your client is up for is probably best. And remember, omega-3s can work to inhibit that COX pathway that typically converts arachidonic acid into inflammatory mediators, those cycloendoperoxides. So this can be really powerful medicine for decreasing total inflammation in the body and pain, improving cognition. Omega-3s are just beautiful. Tolerable upper limits for omega-3s are around 5 grams per day for someone who's not taking a blood thinning medication. Over that might increase LDL cholesterol, so also be careful in your folks with heart disease that you don't go above 6 grams per day. And then as we move into anxiety, what you'll see, anxiety is actually our number one mental health disorder in the U.S., and 2.5 million Americans suffer from panic attacks each year. There's a number of deficiencies associated with panic. I want to take you through a case study. My client, Mary, when she came in, her blood work looked like this. She had altered NA and a little bit of what looked like early hyperthyroidism. So we actually sent her to endocrinology and rheumatology. And while she was waiting to get in, we did natural interventions that actually ended up healing her completely. She had suboptimal zinc and low hair lithium, and she had a diet that looked like this. So lots of inadequate intake of a lot of the important antioxidant. We put her on a multivitamin that contained adequate vitamin C. A gram of vitamin C per day has been established as being superior to placebo for controlling anxiety. We gave her lots of vitamin C foods, red pepper, oranges, grapefruit, kiwi. We made sure that her iron and B6 were replete and that she was consuming enough of those each day because low serum concentrations of iron and B6 are linked to panic attacks. Signs for suspecting an iron deficiency would be increased loss in menstrual bleeding or in stool, reduced absorption due to taking a PPI, having H. pylori or celiac, Remember that headaches can be a sign of iron deficiency as well as fatigue, and that fingernail changes can also be another red flag that someone's not getting enough iron. I think a lot of us tend to think of fatigue and restless legs, but there's more than that. And headaches is one I often see that gets missed. To test for iron status, your CBC is a great indicator here, as well as your iron panel. Then always work up the root cause. If you're not sure why they're anemic, check. Look for H. pylori or celiac and make sure that they're not having any GI loss of blood. If they're consuming non-heme iron from plants, make sure they're consuming it with a vitamin C source to increase absorption. So I love putting some red bell peppers, which have high vitamin C, in with some white beans so that it increases the absorption of iron of white beans, which are plant-based. Make sure to take iron away from food and calcium supplements. Take it away from PPIs. You can actually take iron with vitamin C, which is cool. And then take it away from really high fibrous foods or foods with lots of tannins. And so tea, coffee, eggs, try to take it away from that. When someone's menstruating, they lose about 1 to 2 extra milligrams of iron per day. We tend to lose about a milligram of iron per day normally. And then during menstruation, it can be more, even more if someone is really heavy bleeding. So take that into account when you're thinking about how much iron someone needs. In terms of B6, chickpeas are the number one source of B6, and then beef liver. So a little bit of hummus with some red bell pepper could also be a really beautiful snack. That's very medicinal for your client. Signs of B6 deficiency include swollen tongue, scaling of lips, and cracking of the corners of the mouth. Depression, confusion, anemia. Abnormal EEG findings, including seizures, can be linked with vitamin B6 insufficiency. A risk factor for vitamin B6 insufficiency is other B vitamin deficiencies, including B12 and folate, autoimmune disorders like rheumatoid arthritis, celiac disease, Crohn's disease, and IBD, alcohol dependence, impaired renal functioning. Now, to test for B6, you'd want to look at blood usually. And if you can't do blood, you can also do urine. So you could do plasma B6 or pyridoxal 5-phosphate or erythrocyte transaminase activity, urine for pyridoxic acid excretion, or elevated urinary xanthorrhenic acid after a tryptophan low can also show you that someone may have a B6 deficiency. Remember, when you're supplementing, you really only need about 2 milligrams of B6 per day. And while it is water soluble, making sure that someone isn't consuming too much is important. You really only need to supplement someone for maybe 10 milligrams a day if they're like severely deficient. But when people take much more than that, so maybe 1,000 milligrams or more per day, they can get neurological symptoms, including paresthesias, neuropathy that are not fun. So make sure you don't have your clients supplementing too much and screen them for what they are taking, because sometimes people are taking too much without knowing it. Another important point, B6 helps with the conversion of glutamate to GABA, so helps take a very excitatory neurotransmitter and make it really calming. And so if you don't have B6, it's really hard to do that. Food sources of GABA include things like tomatoes, soybeans, adzuki beans, mushrooms, buckwheat, peas, rice, sweet potato. Think of a nice warm chili or soup and how that makes us feel calm. That could be because those foods have GABA in them. And actually, fermenting foods makes the GABA content about 10 times more bioavailable than it would otherwise be. So fermented vegetables and soy, things like kimchi, things like fermented soy, could be a really beautiful thing to add to the meal plans of your clients who have anxiety, who you think need more GABA. Now, the one thing to keep in mind here is fermenting foods also increases the histamine, which we're going to talk about in a minute. So keep that in mind if you think your client has high histamine anxiety. Omega-3s are just the most beautiful thing ever. And they do so many things in the body, as you can see from this graphic here. My favorite study ever looked at substance abuse recovery folks who were taking 3 grams of omega-3s for 3 months. Compared to placebo, it dropped their anxiety scores by more than, so it went from an average of 5 to an average of about 1.5 on the anxiety scale, which is major. And their anger dropped as well. So same thing, average of about 4.5, 5, down to about 1.5. So really cut these levels of anxiety and anger by 2/3, and just from omega-3s. The dose was high, 3 grams per day. Dose does matter. I don't tend to see a clinical benefit for my adults with anxiety and anger unless they take at least 2 to 3 grams of omega-3, sometimes even more if they're in a larger body. Inositol is another one of my favorite interventions. We used to consider it a B vitamin. It's now considered a glucose isomer. Many of you are using it for your clients with PCOS, but it works incredibly well for panic. So it's been compared to fluvoxamine in a double-blind randomized controlled crossover trial. And it's also been studied in a double-blind randomized placebo-controlled trial at very high doses, 12 grams, 18 grams a day, and was found to be superior to both placebo and an SSRI at controlling for panic disorder, which is just amazing. Really didn't have any side effects. It's super safe. You could take tons per day and you'd be safe. The only side effect you'd get if you went too high is diarrhea, maybe a little bit of bloating if someone has SIBO. And this is a really beautiful intervention. Just put in somebody's water all throughout the day, put powder in their water for a few weeks. It can stop a panic attack in its tracks if you take a bolus dose in water. It's truly, I think, like a miraculous intervention. And if your client has a metabolic disease, then this can be really useful for them. So for Mary, the client that we were talking about who had panic attacks, we gave her inositol, comprehensive multi, omegas, butterbur extra. She was having migraines, so we gave her that too. Some GABA and nights, and a little bit of lithium because her hair lithium seemed deficient. After we gave her a meal plan, her nutrient analysis looked like this, so way less yellow, way more green. We also did a little bit of biofeedback training with her. And within a month of this protocol, Mary's panic attacks were gone. They have been gone since then. It's now been over 2 years. She's completely in remission and she feels great. And she has her life back. She can drive, go to school, do all the things she needs to do. So you can really set someone free with this protocol. Now, histamine can play a role in hyperventilation. Histamine, even without affecting our lungs, can change our breathing rate by affecting our chemoreceptors in our arteries and through that vagal-afferent pathway. So increased amounts of histamine are going to increase your propensity to hyperventilate, which can increase your propensity to have a panic attack. And just as a reminder, signs of an anaphylactic or histamine-based allergic reaction, they include things like itching and swelling of the lips and throat and tongue, but they can also include, or only include, neurologic symptoms like anxiety, apprehension, sense of impending doom, headache, confusion, seizures, young kids having super, out of the blue behavioral changes. Make sure you're working clients up for food allergies and food sensitivities. If they have panic disorder and anxiety, you may find that you discover that histamine is at the root of many of their symptoms. If that's true, quercetin and DAO can be really useful supplements for you to consider as well, as vitamin C, magnesium, zinc, vitamin D, and probiotics. I tend to use things like histamine. I tend to use things that contain nettles and quercetin together, prepackaged, so my clients aren't taking tons of pills, and then just working on their liver health with that sort of leaky bucket analogy can also be really useful. So testing for anxiety and panic attacks, consider things like iron panel, red blood cell omegas, B6, vitamin C. You could use urine testing or serum testing for those. If you're concerned about histamine, you could do IgE allergies and also serum tryptase or whole blood histamine if you want. The other thing to keep in mind, it's not just about what your client's consuming, it's also about what they're absorbing. And there is a really phenomenal paper on the immune gate theory of psychopathology. So looking at gut-derived immune activation in major psychiatric disorders, looking at leaky gut and the precipitation of things like depression, anxiety, and more. So checking your client's gut can be really useful. If you want to screen for intestinal permeability specifically, you could do something like a lactose-mannitol ratio, which involves ingesting a small amount of lactose-mannitol mixture and then measuring the urinary amount of each. Mannitol is supposed to stay in the gut and get eliminated. Lactose is not really supposed to be super well absorbed. And so that test can give you some insight into someone's intestinal permeability. Looking at things like celiac disease, increased LPS in the blood, lipopolysaccharides are on the outside of gram-negative bacteria. They're supposed to stay in the gut and not make it through the gut barrier. And so if they're in the blood, or if you have anti-LPS antibodies in the blood, that could be a sign that you have some intestinal permeability. You can also check for zonulin. Many stool tests actually now include zonulin as a marker in them, which is really nice. And if you want to check for dysbiosis in the urine, you could look at urinary indican. Now, I went through a ton of biomarkers and I've separated them out for you here. So here's what you would check in the blood. Here's what you would check in the gut. Here's what you would check in the urine. And then in terms of checking for hormones that have been linked with depression, anxiety, you could check those in the saliva as well. Cortisol is abnormal in many folks with severe anxiety and depression. And at first, it can be really high. And then in end stages of stress, it can get really low. And either one of those states can impact someone's likelihood to have a mental health symptom. So checking those can be really useful too. And obviously, let's talk about thyroid for a second. You can check thyroid in the blood. You can also check it in the saliva. But having hypothyroidism is going to make you very depressed. Having hyperthyroidism is going to make you very anxious. So make sure you're ruling out thyroid disorders for your mental health clients. You can create a custom blood panel with all of these. And so it's going to cost different amounts depending on which lab you're going to use. And then many of these, and I highly recommend you do that, whether it's if you have a LabCorp sheet, you can do it on or Quest, because it's easier to create something and call it the depression panel or the anxiety panel. Bring it up when you're with your client and then remove what you don't need than it is to try to remember all the things we just talked about on the fly with your client. So I highly encourage you to check that out. There are some biomarkers that cannot be measured in a certain type of sample. And so if you're someone who really wants to show your clients, look, you have increased markers of oxidative stress, you have to remember you're going to have to order a urine test for them. You're not going to be able to check for those really in the blood. You can check HSCRP, but the oxidative stress metabolites are generally in the urine. So make sure that you're creating some kind of bundle where you have a blood panel going out, but also you're able to order a urine test at the same time. So there are a number of tools on the market available to help you do that. But putting together this panel before you see your client and then just taking off what you don't need can save you a ton of time and make sure that you don't forget to screen them for something really important. So you guys are busy. You see a lot of people all day. So key takeaways. Neuroinflammation and oxidative stress play a major role in the pathophysiology of mental health conditions. Our old paradigm that just used DSM-V and talk therapy left the body out of the story. But in the DSM, it says you have to rule out medical conditions before you can diagnose someone with a psychological illness. And so make sure you're doing that. Nutrition can play a major role in addressing these issues. And you can help your clients get better, as you saw from the case study. So I'm thrilled to be here with you guys today. We are happy to help you with any tools that you need to accomplish the mission of helping your clients with this. I will chat to you soon. I'll talk with you soon.